In addition to the memory loss and cognitive changes that most people think of when they think of Alzheimer's disease, the damage to the brain also causes behavior and psychological symptoms. These neuropsychiatric symptoms lead to mood and emotional changes and can be disabling. These symptoms are highly stigmatized and frequently dismissed as willful behavioral problems. But the reality is that they often require medical attention. They are as much a product of the disease as changes to memory and occur as different parts of the brain are damaged by the disease. In this video, Dr. Carolyn Clevenger, director of Emory's Integrative Memory Care Clinic, shares her expertise when it comes to managing one of these neuropsychiatric symptoms, wandering. What is wandering in Alzheimer's disease?
Wandering is one of the scariest symptoms, I think, in Alzheimer's disease. At some point in that illness, we lose a sense of familiarity in our surroundings. And so when nothing looks familiar, everything looks new. So when we think about wandering, we think about leaving your home. Your home might be your facility, but it also could be the place where you were supposed to be. That's a very generic way. So if you were supposed to be in your doctor's office in the waiting room and you have a sense that you're supposed to do something or be somewhere and it's not here, then you walk off.
What are the risk factors for wandering?
The reality is no one is a wanderer until the first day they wander. And it's relatively straightforward to put safeguards around someone to prevent that from happening. So truly, if you are living with Alzheimer's disease that is diagnosed, we know this is a progressive illness. We know you are at some point going to have issues or challenges recognizing a familiar environment and familiar people, even if they should be familiar to you. That means you're at risk for wandering. And the difference between someone who's at risk and who actually wanders sometimes is just the difference of someone who's more mobile. So they have the means and the capacity to wander or do the wandering behaviors of trying to go versus not being, if they're bedbound or chair-bound, then of course they won't have the wandering behavior.
What other neuropsychiatric symptoms develop at the same time as wandering?
Wandering tends to occur alongside anxiety, certainly. In anxiety, I might see someone who paces or rummages, and sometimes pacing sort of ends up taking someone out the door. People become more anxious when they are feeling like things are less familiar. So that might be more situational than chronic anxiety, but certainly that emerges. Sometimes when someone has disrupted sleep, so they're either waking up during the night or they're not falling asleep, they may attempt to leave the home at that point because they now maybe have a false belief or a delusion. So psychosis may also appear, and they believe they need to be somewhere. And they get there not because they're just sort of seeking something that's more vague, but maybe they think they need to be at work or they need to pick up their children.
What can be done about wandering in Alzheimer's?
If we know they have a history of wandering or they really are unfamiliar, they're asking while they're at home, they're asking to go home, or they're asking to leave frequently, or they really are not recognizing people around them. Now that risk for wandering has gone a bit higher. We might want to restrict exiting a space. That doesn't mean in one room, but certainly for the home, you want to think about things you can put in place to sort of preempt that wandering episode. And if they wander while driving, that's not that they can't drive safely. They may still be able to work the car, their executive function works, their visual spatial works, but they would absolutely be lost in familiar surroundings. And so we want to know either we're tracking the vehicle or maybe we don't have driving privileges now only because of the wandering risk, because it's quite high. So one of the things that people can put in place is, you know your person is at risk. I have a low threshold for recommending ways to find them if it does happen in worst case scenarios. So one of those would be Project Lifesaver. This is a program where you can register, you have a band where your person's comfortable wearing it, so that we can find them quickly. It engages your local law enforcement agencies who have been trained and have a better idea of how to approach someone who's living with dementia and wandering, which is a little different than like the blaring lights and the officers and all of that sort of thing. So that if your person does wander, again, worst case scenario, we have a rescue strategy that we've already planned ahead of time to find them quickly.
What questions can families ask clinicians about wandering?
One thing I would say for families when they're working with their clinical team around wandering is Understand when your clinician says your person is at risk for wandering, that does not mean that they will wander. We know that they haven't wandered. But this is one of those things that even though it happens rarely, the severity is so significant. What you want to know are, what are the safeguards that I need to put in place? There's always a balance of making sure your person is safe, but also not controlling or limiting their movement in an unreasonable way. Everyone as an adult wants to make decisions. They want to have freedom to move about their environment as they want to.
What if your loved one is experiencing wandering in a long-term care setting?
If your person is residing in a senior living community, whether that's an independent, memory care, assisted living, long-term or skilled, wandering is certainly on the minds of the staff there. It is one of the never happen kind of emergencies for them, and so they're certainly considering it. One of the challenges or one of the questions you would be asked when you move your person to a senior living community is the level of care, which is always a decision for families to think about what can they do by themselves, what do they really need support with. One of the distinguishing features when someone is often needing memory care specifically is wandering history or a high risk for wandering. Among other things, memory care floors, memory care facilities, or units, however it's structured in your community, will have a locked door that may require a code where someone needs to have more executive function to open it, but it is going to be more restricted access so that your person cannot leave.
Wandering can be caused by changes in the brain and can be treated to lessen the burden of an already devastating disease. For more information and resources, visit agingresearch.org/NPS.